Hello, everybody! Happy Wednesday! Yay! Today we are here Wednesday to answer all your questions, talk about how we can get you and your family healthier. And accompanied with me today is
Abdullah.
He is my 11-year-old, and he's been helping me, educate the world on inflammation and how we can just be getting healthier as a family together. Because is it pretty difficult or hard? Haha, I tricked you with that one. Is it easy, hard or easy?
Easy.
It's pretty easy. Yay, you heard it from an 11-year-old. So we are going to go ahead and talk about, we have been talking a lot about chronic inflammation and how no matter what your chronic conditions are, if you're dealing with headaches, visual changes, nausea, vomiting, digestive issues, they all have an underlying root cause of chronic inflammation. And we have this amazing chart back here to show you, and that's basically your body off balance. So here, Abdullah can go ahead and tell you a little bit about, all of this. So Abdullah, you want to tell them? So you have this fire in your body, right, which is known as chronic inflammation. That's causing your chronic symptoms. Because remember, you guys, I'm a board-certified integrative holistic family physician. So guess what? We were never taught nutrition. We were never taught stress management. We were never taught any of these things. My husband has to see 110 patients a week for our paycheck not to go half. So guess what? We get paid for how many patients we see, not how many patients we heal. Isn't that crazy? So if you guys are on today, I see a lot of familiar faces. I would love to give me some heart love. Tell me where you're watching from. If you have any questions for me or Abdullah. I would love to know what you guys are wondering. What are your obstacles in trying to heal or trying to get your family healthier? Because guess what? If I got a crazy life, do I have a crazy life?
Yes.
He's like, what am I supposed to say to that? So if I have a crazy life and I can do it and these kids can do it, I can do it. So this is amazing. So let's go ahead and talk about, so no matter what you're dealing with, if you're dealing with asthma, allergies, sinus issues, fatigue, problems with digestion, autoimmunity, cancer, or if you're just mood disorders, all of those have one underlying root cause. And that underlying root cause is inflammation. So if we can lower the inflammation, and optimize your mitochondria to work better, guess what? And that you just heal not one symptom, but then all of them simultaneously. And that is what's so beautiful. So in order to lower this inflammation, we have to first heal the underlying root cause, and that is all of these foundations of good health that we talk about. So Abdullah's going to go ahead and talk about this in a little bit more detail. Abdullah? So what are the foundations of good health?
So the first one is healthy gut.
Mm-hmm.
You have to have a healthy gut. The second one is healthy foods like non-GMOs and
to lower insulin resistance.
Yeah, and not to eat as much dairy and gluten and sugar as don't eat that a lot or anytime.
Okay, and then the next.
And then there's detoxification.
Mm-hmm.
And then after that, there is stress management. Sleep, and then gratitude.
Yes. Make sure that we optimize our sleep, and we have to, spiritually, we gotta improve. And how? By gratitude. So how do we improve gratitude?
You have to meditate and sing the thankful song.
They sing the thankful. Here, come back in the picture. Where'd you go? So we are here from Evelyn. Hey, Evelyn from New York. Yay. Yeah, we're going to go ahead and talk about diabetes and weight loss. You can go through my other videos. But all of it really has to stem from lowering inflammation. And if you really have diabetes, I would recommend lots of intermittent fasting along with healing your gut and putting yourself more on like a keto green type diet, which I really love, which is tons of vegetables, a little bit of protein, a little bit of healthy fats. And really, if you need fruit, focus on some low glycemic fruit, but really get grains and dairy and sugar and processed foods out of there because it raises your blood sugar level. So I hope that helps. Excellent. So today we've been talking about the integrative modalities. And integrative modalities that we can be using, because we went through the foundations of good health. You guys can go through my videos. I've been doing this for a very long time. Lots of little videos with great information that you can start to really jumpstart your healing process. I even have a free healing guide, a healing bundle. And guess what, you guys? I also have a course coming up. It's called Real Healing for Real Life course. So subscribe to my newsletter. I'll put the links below, but it is an amazing source to jumpstart your health. I get you four ebooks. One, like my recipe book, that has 25 recipes that work in my crazy household, and a shopping list, what a healing week looks like, and what a healing day looks like. So it can't get better than that. I really put all I could to give you like the tips that I say to patients on a regular basis in that book, so you can help guide yourself. Plus, I have an amazing book called The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease. Make sure to check it out at any of the libraries, on Amazon. It keeps on selling out, so that must be a good thing. So Elizabeth, hi Elizabeth, asks, have you done a talk specifically on celiac disease? So not yet, Elizabeth. I will go through that, but again, all the same foundations really apply. I do talk about celiac disease quite a bit in my book. So thank you guys for the heart love, yay! And we want to, again, if you're watching, I would want to know where you're from. If you have any questions, what kind of things are you struggling with? Because guess what? We have the expert here. So don't hear it from me, hear it from him. But we've been talking about how these are the foundations of good health and how integrated modalities can really help boost your healing process. And something that we use a lot in my house is what?
Homeopathy.
Yeah, homeopathy. So what's really cool about homeopathy is that actually my grandfather was a homeopath. And right when he was a homeopath, and all of us are like conventional allopathic doctors, I really wanted to, honor him and everything that he stood for. So I studied homeopathy while I was in residency. And one of my patients came with me to me with erythema nodosum. So at this, I'm just doing this just to hopefully my grandfather is smiling up there. He passed away like when I was really young. So I was doing this to honor him, and so I became a homeopath. And during residency, when I was doing this, obviously I was a little skeptical because, again, residency, that's what they taught us. So one of my patients had tried everything for her erythema nodosum, and she had these rashes all over her body, that like these huge red patches. And she was 70 years old. She's been doing this for she's been seeing dermatologists for 50 years. She's had it since she was 20. And just by adding in some homeopathy, it blew my mind. 4 weeks without even a diet change, which is a little crazy. She was already on a healthier diet. But 4 weeks, it was all gone. And that's why I'm like, okay, with homeopathy, and these are, again and again, with my skin issues, I really like to use homeopathy with sinus, allergies. But there's so many things, not saying hi, Now you're making him blush. So that's why just by adding homeopathy, it was a huge difference. Again, homeopathy has no side effects, has no interactions, and me and my father and all my aunts and uncles all practice homeopathy. So it's been something going on. That's something you can do to adjunct your conventional care to homeopathy. Always talk to your doctor before implementing anything, but this is something to discuss with your primary care. Because what homeopathy is, it was found in the late 18th century. And it's based on the law of similar. And what that is, it states that the disease can be a disease can be improved by a medicine that creates a similar symptoms to those that the patient is experiencing. So the remedy can be chosen after what I do is I do like a full-fledged history, and it's when they go through their mental, emotional, physical. And then I really go through that in a little bit more detail, okay? But remember, like homeopathy is all natural, right? And can be used for like so many different acute and chronic conditions in conjunction with your conventional care. So Abdullah, let's go through, let's recap, okay?
Mm-hmm.
So what is homeopathy again for those people that just hopped on board?
Homeopathy is the treatment of disease by minute doses of natural substances that in a healthy person would produce symptoms of
So it's
disease.
like cures like. So it's very similar to why we give why do we give ADD a stimulant? Have you ever thought about that? Very similar. But yeah, so it has great, Evelyn, it does have great improvement for depression. Again, something that you can adjunct. I wouldn't do this completely. I always found a focus on the foundations of good health, and then I take it from there. So because they say that an estimated, in 2012, there was an estimated of 5 million Americans and 5 million children that use homeopathy in that year alone. So it's crazy. And it actually dates back to the 1700s. And it's the second largest therapeutic system in the world. Isn't that crazy? And then there's so many different like natural substances in homeopathy. So natural substances used in homeopathic medicine. So they actually take these tinctures. They take them from, Abdullah, do you know what they take them from?
They take it from caffeine, vinegar, garlic, activated charcoal, fresh or dried herbs, mountain herbs.
Yeah, awesome. Yeah, so many different, because again, all natural to help with acute and chronic conditions. And what's really cool is that it's ultra diluted. So it's super, super, super diluted. And there's really, it just sort of pushes your body in the right direction of healing, which is really cool. So, but then there's been so many clinical trials. There's been more than 100 clinical trials that have shown that homeopathic, so if you decide to use it, it is very little risk. Because Abdullah, what are the things that people can use homeopathy for?
They can use homeopathy for low doses of natural products are used.
Yeah. So like here. So then we have is like for low doses can be used for Abdullah for which one? So like depression.
Yeah.
What else?
They can be used for depression, allergies, asthma, migraines, digestive problems, anxiety or disorders, arthritis, fatigue, thyroid or autoimmune disorders,
and even anxiety. So it can be, so Lacey loves homeopathy. Yes, Lacey, isn't homeopathy amazing? What do you use it for in your family? And then Evelyn, anything for depression? Absolutely. So I would go through my book. It's very particular about how your symptoms are depending on the types of medication or homeopathic that you would use. And on the back of my book, I really go through like, first I go through your chronic. So what kind of, that's another medication you can use, like a chronic medication first, and then you can use an acute medication. The acute ones are all listed in my book. In the actual, it's if you go to depression, there's a list of homeopathics and see what best works for you, and then try it from there. But I would also recommend, there's so many concoctions out there that already have this. And remember this, so there's, so many amazing benefits, again, as Abdullah has told us, that it can, that they really look at all aspects of the individual patient are considered. So really going in depth of exactly how you're feeling, how you felt it, when it started, everything, maybe too much sometimes. And then there's actually, it's very low dose of natural products are used. It helps treat allergies and asthma. Ali Baji, thank you, Alia. And then it helps to treat allergies and asthma, reduces anxiety, depression, helps treatment control pain. So there's so many amazing things that it can do. And we talked about that. So there's lots of different studies. And remember when you... we got lots of people. So remember when you use homeopathy, so if you do decide to use it, there's very little risk. But again, still talk to your doctor. Obtain your homeopathics. Obtain your homeopathics, remember, from a reputable source to make sure there's no added heavy metals. Do you guys see this? It's like a coin. From heavy metals. Again, liquid. Thank you. Oh, he has a gem here. Do you want to go? Okay, thank you. And remember, again, if you're pregnant, nursing, you want to make sure you do this with a doctor's referral. It can be purchased as a combination remedies, which is really cool. So we use a lot of combination remedies for allergies, allergies, sinus issues, cold issues, pain. Arnica is our favorite one to use for pain. Oxylococcinum is a great one for like flu type symptoms, or just taking it regularly to prevent the flu, or even as soon as you start feeling like symptoms, you can take that. It knocks it up, and they've done tons of clinical trials on that, so you want to take a look at that. Again, you can purchase these as these combination remedies. Again, PMS, there's great ones out there for PMS. And so many other different ones. And then there's also single remedies, so you can go through my book. Again, remember, homeopathics are regulated by the Food and Drug Administration, so the FDA, but the FDA doesn't really evaluate these for effectiveness or safety of each of these remedies. So you always want to make sure that you go to, like, especially if you're looking for a practitioner, you want to make sure that you're going to the NASH, the North American Society of Homeopaths. And they actually have a directory of homeopaths there, and you just want to make sure what their credentials are. So look for certifications for, I did it from the CEDH, so those are places. But again, remember, there's different tapers that you can do it, and you can do like 30C is stronger than 50C. So the higher the dilution, it's a little bit stronger. And so you can take it for your symptomatic, you would take like 6C, 12C, 15C, or 30C, and then after your symptoms resolve, so you can increase it. Like, for example, if your pain or symptoms are really high, you can increase the amount of dosages. But again, talk to your doctor. And then if not, then what we want to do, if like your symptoms improve, then you can cut back on it. So that's what's really cool about it. It really shifts your body in the direction of healing. And remember that some can be listed as X dosage, and C is more diluted and stronger than the X potency ones. So those are simple things that I would recommend. Again, you want to make sure they're ultra diluted. There's, they may be an initial worsening of symptoms, but that does resolve that, but you can just adjust the dosage. And then homeopathic medications have really, remember, limited side effects, and drug interactions are really safe to use for children. So if you have any other questions, feel free to ask us, because I have been bombarded by kids who are having fun in the background. So again, there's so many studies out there. If you guys want the list of studies they've actually done at least 142 trials have been published in scientific journals regarding homeopathy. And the School of Homeopathy has actually found up to 85% of random control trials that demonstrate that homeopathy is more effective than placebo. There has been 5 meta-analyses reviewed by the homeopathic trials to date, and you can take a look at that they have appeared actually in the European Journal of Clinical Pharmacology in 2005, and 4 analyses showed overall that the homeopathic were better again than placebo, and then a 6-year trial released in 2005 in the Bristol Homeopathic Hospital reported 70% of the 6,500 follow-up patients experienced improvement in their health after receiving homeopathic treatment. So, I mean, there's a lot of information out there. Again, it's a little bit more difficult because of the fact that there's such an individualized treatment. So just because one doesn't work doesn't mean none of them are going to work. So I hope that helped. So, Abdullah, you've taken homeopathics. We've all taken it, especially for pain. the kids get, if they've been running a lot, they do stuff for pain, running a lot or just muscles. So we have arnica that we use for that. Okay, so that's our favorite one in the house. Sinus, allergies, we don't use a lot of that. I mean, thankfully that doesn't, but then I did when my son seemed like he went to Vancouver and got some allergy type symptoms. He's better now, but I use some homeopathics that are even organic. So you can buy them at any nutritional store, and it really, really helped him. So I hope that's all great. Again, talk to your doctor to make sure that it's the right fit for you and make sure that there's nothing else going on. But you want to talk to a doctor that is really well knowledged in this and versatile and has the information that he needs so he can give it to you correctly. Okay, you guys, there is being an attack currently in this room. So I will talk to you guys later.
Hello, guys.
Yeah, see? If you have any questions, please let me know. Again, like and share this video so we can spread the message of hope and healing to those people that need it most. I'll see you guys later. Yay! Have a great day. Bye, you guys.